at that. It started beeping at me.
Hold on. Something just happened. I pushed a button.
Uh-oh.
Okay, go ahead.
Okay, so it started beeping at me a little prematurely there. So I'm gonna try this again, see if we can't get it to, like I said, it's pretty finicky. Okay, we're not beeping at all. But you notice we got a couple lights there that are blinking. First one and I'm just going to tell you the order that it kind of prefers to go in is you push that lumbar and then you adjust your pressure. Okay, with these, again, depending on what we're using the traction for to treat, the way you adjusted those, you hit that max level, it zeroes everything out, and these up and down buttons don't really do anything. So you have to hit max level, and then you'll come over and use the little keypad over here. We'll put 50 pounds just for kicks and giggles. If we were doing intermittent, then we could have a minimum level as well. We're going to do just static all the way across the board, meaning that it's going to take one step and just continue on pulling on this rope until it gets to 50 pounds of traction, and then it'll go through the treatment, and as soon as we finish the treatment, then it'll just go down until we're completely relaxed and release that traction. Again, if we had intermittent set, then we could have 50 here, and we've got 40 pounds here, meaning that it's going to that max traction pressure is going to be at 50 pounds, and then or at least during the hold time, and then we could have a rest time where it would release and go down to, in this instance, 40 pounds of pressure, or pull, I should say. Again, where we have it static all the way across, we're going to kind of keep that, and just so it's easier setup. If we were doing, or depending on what we were using this traction for, again, you would need to change those so that you could have some intermittent hold and then relax during the actual treatment. So we've set our max and our min level. We're not going to have to worry about hold relax time at this point. Again, if we wanted to though, then it's going to be similar to here where you push hold time, then you have to use the keypad to actually push in the button. Now you'll notice that even though I push the lumbar to stop it blinking fast, it's blinking fast again. This is the machine, it's old. So we hit lumbar again to satisfy that, and then we come over and we hit treatment time. It's blinking fast as well. Now we get our numbers up here for our total treatment time. Let's say it'll start at 2 minutes, but let's say we want to go 12 minutes. Okay. Once you get to this point, hopefully the only thing that's blinking is lumbar, and it's doing it slowly. That means that we're okay. It's fine with that. We're good to go. You'll notice also that even though I put in 12, it added 2 minutes, meaning that it's going to take about 1 minute to ramp up to the 50 pounds, and then it'll take a minute to ramp down at the end of the treatment session. Okay. So we've got our machine fixed, or not fixed, but set and everything. This is the emergency off button. This we're going to hand to our patient and let them know if at any time you start to feel uncomfortable or want to stop the treatment, hit that button and it will slowly release. Okay. So once we've done all that, we hit our start button. We're not going to release the table yet. We're going to let it pull up for a little bit. Actually, we're doing static, so we are going to release the table. There we go. We've released the table. If we were doing intermittent, we would actually let it go through one time, and then we would release the table, just so that we're not going to have a table that's crazy spread out throughout the entire treatment. You can notice that table is starting to spread. The patient should be feeling a little bit of traction occurring. We're almost to that 50 pounds. So there's our 50 pounds. And as he sits there, if he breathes in and out, or if he's breathing heavily, it can actually change and it can release a little bit of that pressure. And then the machine will just continue to pull to maintain that 50 pounds of pressure throughout the entire treatment.